Good afternoon, everyone. Welcome to our educational webinar on drug interactions in myeloma and how to avoid them. My name is Gabriele Colacerdo. I'm the Manager of Education and Patient Services at Myeloma Canada. And thanks for joining us. We're happy to have you here. Before we get to our presenter and our presentation on drug interactions, let's thank our sponsors. I'd like to thank our sponsors for providing educational grants to make these webinars possible. Without their help, it would be very hard to do these. So thank you to Amgen, Binding Site, BMS, Janssen, and Takeda. For those who have been on our webinars in the past, you'll know that they're all recorded, and the recordings are made available on our YouTube channel. So youtube.com. If you type in Myeloma Canada in the search bar and then click on the search icon, you'll one of the first channels you'll see is Myeloma Canada. You could click on the big red button to subscribe, and you'll also have the option to get notifications, so that every time we upload a new video, you'll get a notification either on your phone or by email, or whichever way you choose to receive your notifications. And that's a good way to stay up to date with the latest videos that we're putting on there. From our website, you can also access our recordings. So myeloma.ca, in the top menu, you click on the resources button. The menu will open up, and then you just find the link that says educational videos. That'll simply just redirect you to the YouTube channel with all of our videos. Lastly, how do we ask questions? And so no matter what type of technology you're using for the webinar, whether it's a computer, whether it's a tablet or a phone, you're going to see somewhere where there's a button or a window that says questions. If you click on that and then type in your question and click on send, I'll receive all the questions. And at the end of the presentation, I'll be happy to ask our presenter those questions, and we'll have a discussion around all the questions that you sent to us. So please don't wait till the end to send your questions. As you think of your questions, please send them in. That way, when we get to the end of the webinar, I'll have them ready to go, so that we can discuss them. So without further ado, I'd like to introduce to you our presenter today, Al-harith Mohammed, who is a clinical pharmacist in malignant hematology at the Juravinski Hospital, that's based in Hamilton, Ontario. Al-harith, thank you so much for taking the time this afternoon to join us and talk to us about the drug interactions in myeloma.
Thank you, Gabrielle, and thanks for everyone for taking the time on a Friday afternoon to listen to this. Our presentation today is about drug interactions in multiple myeloma and how to manage them or avoid them. Our agenda for today is to give a quick overview of multiple myeloma and its therapies, and to cover general ideas pertaining to drug interactions. Then we'll move to focusing on drug interactions for common drug classes in multiple myeloma. And then finally, we'll give a summary of key points and recommendations. So we'll start with the first one to give a quick overview of multiple myeloma and its therapies. Before we talk about multiple myeloma, we have to talk about the bone marrow, because multiple myeloma is a disease of the bone marrow. So it's very important to understand what the bone marrow does, because when we understand that, we understand the effects of multiple myeloma. So the bone marrow makes red blood cells, which are important for carrying oxygen around. The bone marrow also makes white blood cells, which are important in fighting pathogens and infections. And plasma cells are a type of white blood cells that we're going to talk about shortly, hint, hint. And platelets is a third thing that's made in the bone marrow, which are used to stop bleeding. Okay. Multiple myeloma is a cancer of the plasma cells, which is a type of white blood cells that produce antibodies. So if you look at the right-hand side, you'll see these cells that are encircled in this red triangle or red rectangle. These are white blood cells that fight infections. And they do that by making antibodies. So antibodies, you probably heard of them, are proteins that attach to pathogens and help the immune system fight them. What happens in multiple myeloma is that we get cancer of these plasma cells, so they become abnormal. So in the picture below, you see that these plasma cells will change, and they will start to grow uncontrollably, and then as a result will start to produce more of these antibodies, now abnormal antibodies. We call them M proteins or myeloma proteins. When the plasma cells continue to grow, they start to crowd what's happening in the bone marrow. The normal cell blood production processes that happen in the marrow, the production of red blood cells and other white blood cells and platelets, these get crowded because of the multiple myeloma, and that's how we see the effects of multiple myeloma, the anemia and the fatigue and the increased risk of bleeding and the risk of infections. Another result of that is the now increased production of these abnormal antibodies, the M protein, that start to build up and cause issues, mainly renal issues in the body. Multiple myeloma is treated in different ways depending on how severe it is or where we are in the journey of multiple myeloma. We sometimes use observation when we have really early disease like MGUS. Some of you might have heard of MGUS. Or if we've already been through a treatment course and we've done our maintenance and now we're comfortable just with observation. Sometimes we use radiation when multiple myeloma cells are congregated in one place. Sometimes maybe you've heard the term plasmacytoma. So these are not diffuse all around. These are only in one place, and radiation might be appropriate for that. But the mainstay of multiple myeloma treatment is medications. And we typically use multiple medications together in combination. And finally, stem cell transplants is a staple in the treatment of multiple myeloma for those who we can do a stem cell transplant in. And sometimes the aim is sometimes to do more than one. This busy slide is here to drive an important point. It's not meant to confuse you. This is especially for those who are new to multiple myeloma, they might not recognize a lot of these abbreviations. But what this essentially is on the left side, these are the main groups or classes of medications that we use in the treatment of multiple myeloma. So there's chemotherapy agents, there's IMiDs, steroids, monoclonal antibodies, and proteasome inhibitors. In the middle there, these are the most common regimens that we use to treat. And a regimen really is a group of medications that are used together to treat the myeloma. So, for example, if we look at the first one, Cyborg-D, this is a combination of 3 medications from 3 different classes. There is the cyclophosphamide, the Cy, from the chemo group. There is the BOR, which is the bortezomib from the proteasome inhibitor group, and there is the D, or dexamethasone, from the steroid group, and so on. The reason why we use multiple medications at the same time is because we know that if we use a lot of medications together, we're essentially zapping these multiple myeloma cells from multiple directions, and we're attacking it with different mechanisms, and we know that that's more effective in killing the multiple myeloma cells. Sometimes once that phase is done, we go on maintenance therapy, which usually includes one or 2 medications. But early on in new disease or in relapse disease, we like to use combinations. And the idea in the future is we will potentially move to combinations of 4 medications together. So how is that relevant to our presentation today? Well, multiple medications that are used in the same regimen means that there are multiple drug interactions for each medication in the regimen. So that really brings up the importance of looking at drug interactions, because we're not really dealing with one medication. We're dealing with multiple medications at the same time. So that's really the extent of what I wanted to cover in terms of multiple myeloma itself, and introduction to that, and what therapies we use. I'm going to jump to general ideas pertaining to drug interactions. Then I'll go back to these individual medications and try to tie these 2 ideas together. So drug interactions in general, when we think of drug interactions, I think the first idea that comes to mind, even for for us sometimes is drugs interacting with other drugs, but that's not the complete picture, because drug interactions can happen with food. So that can be food in general, whether you take something with your medication, whether you have your meal or not, and sometimes with specific types of food, like a lot of you have heard of grapefruit being a food item that interacts with medications, and we'll talk about this and more in a second. Sometimes drug interactions happen with lifestyle, so things like smoking or alcohol. These can have an interaction with these medications, and we'll talk about the details of that in a second. Another one that typically gets missed is interactions between drugs and natural health products, herbals, and supplements. For some reason, we don't maybe tend to think that that these interact because they're natural, but I'm going to try and convince you today that there are interactions there and they're important to know about. The fourth item here is really more for your information. Your doctor is usually more aware of these, so because the doctor will order the test, and sometimes certain drugs will interact with the test. So the doctor knows that that you're on this medication, and so they'll know how to interpret the testing result if it doesn't match the clinical picture. And finally, and what we're going to spend the most time on today, is interaction between drugs, multiple myeloma drugs, and other drugs, home medications that you're already taking. So again, the point of this slide is that drug interactions aren't just between drugs, and that's why when you get these multiple myeloma drugs, your pharmacist might ask you about some of these other non-drug details. And what they're really trying to tease out is if there's any interactions between those other things, your food, your lifestyle, your natural health products, and the new medications that you're getting for multiple myeloma. This other slide here just highlights important ideas about drug interactions. So this is a big field, and there's a lot of pharmacists that dedicate their careers and lives or their career lives really to look at drug interactions, study them and their importance and significance. Drug interactions, when they happen, can alter drug levels, so they can increase the amount of drug in the body and sometimes can decrease it. Sometimes drug interactions will not affect the level. They will only alter the effect of the drug because maybe the interaction is between two things that have a similar additive effect or an opposite effect, so they negate each other. Sometimes drug interactions have various mechanisms, like we're going to see when we go into those details. And a mechanism of an interaction is really how and why the interaction happens. And these mechanisms are sometimes known to us. We know why these interactions happen, and sometimes are unknown. And sometimes there are multiple mechanisms between two interacting drugs. Drug interactions are managed differently, meaning sometimes we cannot use the combination of things that are interacting. We cannot use the combination of drugs together or the combination of the food item and the drug. And sometimes they can be used together. The only thing we need to do is to change the dose or even just simply monitoring, being aware of the drug interaction and monitoring to make sure that the drug interaction is not significant. Drug interactions are also constantly changing. So when a drug becomes commercially available, it comes with a list of drug interactions that we were able to identify during the clinical trial phase of the drug. But as we use the drug more and more, we start to add more things that might potentially interact with this medication from our experience. There's also sometimes we would have a drug interaction that we think is clinically important, and then when we look back and look at how our patients are doing, we realize that that's not necessarily clinically important anymore. So we would, instead of avoiding the combination, we would use the combination of these two medications together, but we just increase our monitoring. And there are multiple examples of that in the literature. What I also want to highlight is drug interactions. The effect of drug interactions is different between one patient and another. So some patients, interaction might be very severe that requires more intense management, where we stop one medication or alter the dose, and other patients, the interaction of the drugs in their body might be very different, where the only thing we need to do is to continue to observe. This is because our bodies are slightly different, from one patient to the other, and sometimes the same patient, throughout their journey, maybe the interaction is not severe enough early on, and later on it might be. So the point that I'm trying to drive here is that drug interactions are complex, they're dynamic, but they can still be managed once we identify them. And I really want to underline the word here, identifying them, right? Once we identify. This slide here is meant to be a simple depiction of a very simple depiction of medication metabolism and excretion. So this is a very big topic, but for our purposes, the idea that I want to drive home here, that you'll see in the next few slides over and over again, is that medications, once they are in the body and they're doing their job, would leave the body, right? They get processed and then they leave the body. So if you look at these pawns here, or these people, think of them as all the medications that you're taking, they're done their job, and now they're exiting your body through this door. So they're going there to get processed and excreted, leaving the body. There are multiple doors that we have in our liver and our kidneys where these drugs will leave to get processed and excreted. And so you'll see these names or codes that I have here, and these are the various enzymes that do this job, or you can think of them as the various doors that do this. An important mechanism of interaction is how these enzymes, or how these doors, how open and closed they are. So there are certain medications that might close this door, and then what that means is that these guys here will stick around longer, right? And their effect will be longer and greater. And there are other medications that will open these doors, wide open, and then these medications will leave quickly before they're able to sometimes even do their job, right? So these are a common type of interactions that we're going to see here over and over. But I wanted to sort of give this idea here, so that when we go into the details, this will make more sense. So this sort of door, open and closed door analogy that we're going to talk about shortly. Okay. Now that I sort of talked about ideas about drug interactions, I'm gonna go into the the meat and potatoes of this presentation. But one thing I want to preface before we go into this is this is not an exhaustive list of drug interactions that are out there. I tried to choose drug interactions that highlight important points for you to understand and digest as a patient. But I want to remind you that these drug interactions are the pharmacist's job and the physician's job to worry about and manage. But your role is very important in helping us and the physicians to identify them and to understand their effect by telling us any effects that you're experiencing, and also you will be monitoring the effects of the drug interaction. So you're very involved in managing and helping us identify drug interactions. But I don't want you to get bogged down or worried about the number of medications that you're going to see on these lists. And what's out there is probably more. But I just bring them up to highlight what's out there, what's important, and I'll circle back in the end and tell you how you can help identify them and monitor for their effects, because ultimately you need to be very involved in your care. Perfect. Okay, so the first class of medications that we're going to talk about is proteasome inhibitors, or PIs. The one that a lot of people are familiar with is Velcade. This is the most commonly used proteasome inhibitor that we have. And just briefly, proteasomes is this thing that's depicted in the middle here. It's found inside the cell. It has important functions. But for the myeloma cancer cell, it helps it stay alive. And so when we inhibit this, when we stop it, we kill the myeloma cells, right? So I'm going to go over these 3 medications, and what I will do in this presentation is I'll try to divide interactions into food, herbals, lab, lifestyle, and medications. So Proteasome interacts with grapefruit juice and pomegranate, and interacts with green tea. Bortezomib is an injection. It's a subcutaneous injection, meaning it's an injection under the skin. So it doesn't really matter if you've had your meal just before you came to the cancer center to get it or not. It's not going to go through your stomach, so it doesn't interact with food in general. However, these food items, it interacts with once the medication is actually inside your bloodstream. So grapefruit juice and pomegranate what they would do is they would close the door. If you remember the slides the slide that I showed earlier, they would close the door, and then the bortezomib would linger around in the body a little longer. So that can increase the risk of side effects, because now the medication is in the body longer than it should be, right? So you'll probably hear your pharmacist and physician tell you to avoid these items while you're on bortezomib. Green tea is a very important one, and the way it interacts with bortezomib is it binds to it and effectively stops its activity. So it's very important that you avoid green tea or matcha containing items, food items while you're on bortezomib. The other item here that I want to talk about is St. John's wort and echinacea, and both of these ideally should be avoided because they do reduce the effectiveness of bortezomib. Now, if you're on St. John's wort for a long time and for an indication that the doctor has started you on, then have a conversation with the doctor about the effect of that, and then see if there may be alternatives to go on while you're on the bortezomib therapy. There's no specific lab interactions that happen with bortezomib, but we're going to talk about general ideas about lab and testing at the end, really with all myeloma medications. The other thing I want to mention here is that this medication can cause dizziness and fatigue, especially early on if you haven't really been on it. So it's a good idea to avoid alcohol on the days that you are getting bortezomib, and to use caution if you're gonna have a glass of wine or a beer, and to try and separate it as much as possible from the medication. I wanted to highlight this again because this is especially the green tea is not something that we hear usually with other medications, and it's pretty interesting and it's pretty important for you to know. Then I'm going to move on to drugs, and I'm using this open and closed door pictures here to try and remind you of the analogy that I mentioned earlier. So there are some medications like phenytoin and carbamazepine, for example, phenobarbital. These are seizure medications that we use to prevent seizures in epilepsy, and they tend to induce those enzymes, or in other words, open these doors very wide. So then that reduces bortezomib exposure because it leaves before it can do its job, and that can affect how well it does its job. So the idea here is to try and avoid these medications if possible, but sometimes you won't be able to, because obviously you're taking them for an important reason, and maybe an alternative needs to be suggested by the physician or to the physician. The other group here is a group that does the opposite effect than the first one. So these are the CYP3A4 inhibitors, so they tend to close the door. Clarithromycin is one that a lot of patients are familiar with because we use it for a lot of respiratory infections, and azole antifungals, some of you might be familiar with, like fluconazole and voriconazole. And again, these what they do is they tend to shut the door a little bit, so then bortezomib will linger around in the body longer than we would like, and that will increase exposure and potentially increase toxicity. For this one, what we would typically do is we just use caution. So we monitor your platelets and neutrophils and hemoglobin. So we do regular blood work more frequently when you're on these medications if we cannot find an alternative. That way we can identify toxicity before it becomes bad, and then we adjust medications, or we find alternatives if we need to. On the second page here, I bring up diabetes medications. In general, bortezomib can cause high or low blood sugar, so it tends to interfere sometimes with our diabetes control. Diabetes is a common medical condition that a lot of Canadians have, so it's not unusual to be on medications for diabetes and have to start bortezomib. And the idea here is to monitor your blood sugar very closely around the time that you get bortezomib. So once you start the regimen, you know, a few days before, a few days after, especially the first few cycles, because you want to detect any effects on your blood sugar because of the bortezomib. The next one here on the list is vitamin C. So vitamin C, again, is a very popular over-the-counter supplement or vitamin that a lot of folks take just for its antioxidant effect. This one, unfortunately, tends to interfere with bortezomib's ability to kill cancer cells. It tends to bind and inactivates bortezomib. So ideally, we want to avoid vitamin C supplements if possible. And if we have to take them, then we want to separate them by at least 12 hours and not take more than 500 milligrams because of this interaction. There are also opinions out there that vitamin C can help with cancer at high doses, but what we typically suggest is while you're on the myeloma therapies, to avoid combining the two. Once that's done and you want to explore high doses of vitamin C, then you can talk to your physician about how you want to do this. But together with these medications, because we know that they will compromise the effectiveness of the you know, at least the bortezomib and actually a lot of other chemotherapy agents, we suggest that you avoid the combination completely. In terms of a drug is associated with peripheral neuropathy, and peripheral neuropathy is just a fancy word for damage or stress on the nerves, especially or particularly at the extremities, so numbness, tingling, burning sensation. Some medications can cause that, like amiodarone or statins. These are heart medications and cholesterol medications. But because bortezomib itself can cause that too, having the two together might increase the potential for this side effect to happen. So that's more of an additive effect. And what do we do about it? Well, we monitor. We ask you maybe frequently if you're experiencing any of these side effects, and if we notice that that's the case, then we adjust the doses accordingly. So here, the important point is that you can play an important part in managing drug interactions by monitoring their effects at home. So whether it's using a blood glucose monitor to look at your blood sugar, to see if there is an interaction between your diabetes medications or bortezomib, or if it's just a simple idea of being aware of the side effects of bortezomib and watching for them, like the peripheral neuropathy, especially if you're on another medication that can cause that. Carfilzomib is another medication in this class, and again, it's injectable, so it doesn't really interact with food, and it does not really have any specific food items that it interacts with. Echinacea is an herbal product that we sometimes use for cold and flu, but it tends to decrease the effectiveness of carfilzomib and a lot of other chemotherapy agents, actually. So we recommend that you avoid it while you're on carfilzomib. There's no specific lab interactions with carfilzomib, and just like bortezomib, there's dizziness and fatigue with carfilzomib. So we would suggest that you exercise caution and avoid alcohol, especially early on, and then eventually separate as much as possible with carfilzomib. Carfilzomib doesn't have as many drug interactions. What I try to do for these different drugs is put an icon here to tell you if these medications are processed by the kidneys or by the liver. So this one is processed by the kidneys, and it doesn't tend to have as many drug interactions as other medications that go through the liver enzymes. This one interact with a group of medications that go through a P-glycoprotein enzyme. So these medications are medications that go through that door, the PGP door, the P-glycoprotein door. So Carfilzomib in of itself is a medication that inhibits this enzyme. So it is the culprit. It will close that door where these guys would try to leave from. So as a result, the level and the effect of these guys, verapamil, digoxin, and morphine, which are just a few examples of medications that exit through that door, will start to go up. And so we monitor for that effect. We monitor for the heart rate, because if the levels of digoxin and verapamil go up, the heart rate will start to go down. We also monitor for things like sedation and dizziness and drowsiness, because when the levels of morphine go up, we feel a lot more dizzy and drowsy. So if you're on these medications, you probably want to let the doctor know. And if you see an important theme that's happening here, which you'll see as we continue to go through this presentation, is there's a lot of medications that interact together, and the expectation is not for you to know them, but the expectation is for you to at least let the pharmacist or the physician know them. That way they can tell you how to manage them. It's certainly once you're comfortable with that, then you can know more about these interactions. But we don't we don't expect you to know these by heart. But that's certainly something that we think about and worry about all the time. The other class of medications here is hormones, so oral contraceptives, birth control pills, and other hormonal methods of contraception, like the patches or the injections. And also I can add hormone replacement therapies. These tend to decrease the concentration of Carfilzomib and maybe its effect. And they do increase the risk of blood clots in of themselves, but when they're used with Carfilzomib, that risk is added together or compounded. So the recommendation is that you use caution when you're on these, and maybe the physician will recommend considering non-hormonal method of contraception while you're on Carfilzomib. Ixazomib is the last medication in this class, and it's an oral pill, so it's ideally supposed to be taken on an empty stomach, because food in the stomach will interact with the absorption of Ixazomib. So it needs to be taken 1 hour before or 2 hours after meals. It does interact with St. John's wort and echinacea. Both of them decrease the effectiveness of Ixazomib. There's no specific established lab interactions with Ixazomib, and no studies done with lifestyle factors like alcohol and smoking and Ixazomib. This is an important point, as this is the first medication that we talk about today that's an oral pill, and it's important to know whether a medication should or should not be taken with or without food. So in this case, it's important to take this on an empty stomach. This Ixazomib goes through the liver and goes through these doors or enzymes that we talked about earlier, and with strong enzyme inducers, strong CYP3A4 inducers. These are inducers that open the door through which Ixazomib leaves. It's important to avoid these as much as possible, because they tend to decrease Ixazomib concentration and effectiveness. Now, if that's not possible, then a conversation will happen with the doctor, and then the extent of the interaction will be assessed, or alternatives would be suggested. The interaction with the other enzymes or with inhibitors of other enzymes is there, but it's not clinically meaningful, meaning the change in the level of the medication did not really lead to any change in clinical outcomes. People didn't have more toxicity because they took these or took this combination of medications together. So it's there, just not very clinically important. The second class of medications we're going to talk about is also fairly common, is the immunomodulatory IMiD drugs. And they target myeloma through multiple mechanisms. But one thing they do is they target this cereblon, which helps multiple myeloma stay alive, and they inhibit it, and that's one way they would kill multiple myeloma. Lenalidomide is the most common class or medication in the IMiD drug. Pomalidomide and thalidomide are other medications as well. Lenalidomide is an oral medication, but you can take it without any regard to having food or taking it on an empty stomach. It's usually absorbed well with or without food. Echinacea tends to decrease its effect, and it should be avoided. There's no established lab interactions with lenalidomide, and it tends to cause dizziness and fatigue, and especially early on. So you want to separate it from alcohol. That way you don't get dizziness or compounded dizziness or added dizziness. And there is a risk of heart attacks with this class of medications in general. And so smoking, as you know, is another risk factor for heart attacks. So, avoiding smoking is important to begin with. But now that you're, now that a medication like lenalidomide that even increased the risk of heart attacks more is started, that becomes even more important. The importance of quitting smoking. Digoxin is one of the medications that interact with lenalidomide. It's a heart medication that control the heart rate. What happens when we take the two together is it can sometimes increase the maximum digoxin concentration, but the way we get around that is we monitor the levels of digoxin. We also monitor the effects, which is something you can do. If you feel that your heart is slower than usual, once you start the lenalidomide and you're on digoxin, then you know that the interaction is affecting you, and then something needs to be done about this. The same concept we talked about earlier about hormone replacement therapy interacting with medications. In this instance here, hormone replacement therapy can cause blood clots, and lenalidomide can cause that too. So there's an additive effect here, and we want to monitor carefully, and we might consider adding a blood thinner or maybe using a different method of contraception if possible. Second medication in this class is thalidomide. So this is, again, absorbed well with or without food. Echinacea tends to decrease its effectiveness. It doesn't have any specific established lab interactions. And just like lenalidomide, it tends to cause dizziness and fatigue. So ideally, we want to separate it from alcohol. And MI here is shorthand for myocardial infarction or heart attack. So like lenalidomide, it can cause heart attacks. So to reduce that risk, if you're a smoker, you want to avoid smoking or quit smoking if possible. Interactions with thalidomide are more than lenalidomide, sorry. It can also cause peripheral neuropathy, just like Proteasome. So if you're on medications like amiodarone, like statins, like lithium, that can cause that, you want to monitor for neuropathy, for these increased tingling or numbness, because the combination together can increase the risk of getting this neuropathy. Medications that can increase sedation, so they can make you drowsy, will have an added risk of that when taken with thalidomide. So we monitor for sedation, extra drowsiness. If you're feeling more tired than usual, then bring that to your doctor, and we'll look at, or your pharmacist, and we'll look at if there's any interactions that's making that worse. Beta blockers. So these are medications that control the heart rate for all sorts of heart conditions and sometimes blood pressure as well. If taken with thalidomide, there's a higher risk of increase in the risk of slow heart rate, or sometimes they refer to this as bradycardia. And what we do, the way we get around that, is we monitor your heart rate, your pulse, when you come to clinic or when you're in the hospital. But what you can also do is you can monitor that yourself, and you can also monitor your level of fatigue. If the heart is too slow, we tend to feel very tired. So if that changes after starting thalidomide and you're on a beta blocker, bring that to your doctor's attention and then, or your pharmacist's attention, and they'll look into it. Hormone replacement therapy is another thing that we, this is the third time we see it today. It increases the risk of blood clots, and that's an additive effect with thalidomide. So ideally, we want to mitigate that by stopping the contraception or using another method of contraception. And sometimes we don't have an option. Sometimes we're using an erythropoietin or a darbepoetin. These are agents that increase your hemoglobin, and your doctor might choose to add a blood thinner, which is fairly common with this class of medications, especially if the risk of these medications cannot, or these interacting medications cannot be mitigated by stopping them. Pomalidomide is the last medication in this class. So it's oral as well. It's absorbed well with or without food, but it tends to interact with grapefruit, interacts with St. John's wort. I think now you're seeing a common theme with these herbal products. No established specific lab interactions. And again, this class of medications will have the dizziness and the fatigue, and will have the increased risk of heart attacks. So avoiding smoking is important. Smoking in this medication with pomalidomide, in addition to causing an increased risk of heart attacks, it also interacts with the pomalidomide directly. It reduces its effect directly, because smoking, believe it or not, tends to affect one of the enzymes in the liver that's responsible for processing some of these medications. So it will open that enzyme or open that door wider, and pomalidomide just happened to go through that door. So that's the effect of cigarette smoking, which can induce the CYP1A2 enzyme, which is one of the doors that we talked about earlier in the presentation. Because pomalidomide gets processed in the liver, you can appreciate that has a lot more interactions with all these medications that either open or close these doors, that induce or inhibit these enzymes. The management usually is to avoid the strong inhibitors if possible, but if you're already on them, to monitor very closely and to maybe find alternatives if you have to be on a medication to treat your condition for an extended period of time. It cannot really take any breaks. That's really the purpose of this slide. There's a lot of medications there, and we don't expect you to know them all, but know that pomalidomide goes through the liver, goes through these enzymes, and anything that interferes with these enzymes tend to affect the level of pomalidomide, either increasing its exposure or decreasing it. If the concern really becomes that if you're taking inhibitors or things that close two doors, then that becomes a bigger problem, and one of them needs to be stopped, or a medication, the dose of one medication needs to be changed. Agents that increase the risk of heart attacks, so hormone replacement therapy, oral contraceptives, cigarette smoking, being an important factor, and also erythropoietic agents. These increase the risk of blood clots and should be avoided if possible. And then medications that increase sedation, make you dizzy and drowsy, like alcohol or other sedatives, when you take pomalidomide together, you might have an additive effect. And it's important to exercise caution when used in combination, especially early on, as you figure out how the pomalidomide is affecting your system. Chemotherapy, there's multiple agents that are used in the treatment of multiple myeloma. The most common two that we use is cyclophosphamide and melphalan. So I'll focus on these two in this presentation. Cyclophosphamide is an old medication. It has fairly wide effects, so you'll see in the next few pages that it has also a lot of interactions as well. It's available as both oral and injectable. The oral, which you will likely use in multiple myeloma, is one that does not interact with food, so it can be taken with or without food. But you want to avoid grapefruit juice with this medication because it tends to decrease its effect. St. John's wort tends to increase the effects of cyclophosphamide, and echinacea, as always, decrease the effect. I don't know if you noticed, but the effects of grapefruit and St. John's wort is the opposite with cyclophosphamide. This is because the way the cyclophosphamide gets activated is different than other medications. Cyclophosphamide and really medications that tend to suppress the immune system. So this is in the cyclophosphamide monograph, but it's also true for medications that tend to suppress the immune system. They tend to cause sometimes false negative skin tests for like TB or mumps or candida, because you need the immune system to react to these skin tests. And if your immune system is suppressed because of these agents, cyclophosphamide being one of them, then it will look like you're not reacting to the allergy test or to the skin test, but in reality you just don't have a strong enough immune system to mount a reaction. Alcohol tends to or might reduce the activity of cyclophosphamide and might induce nausea and vomiting with it. So ideally it should be avoided. This is a very long list of medications that interact with cyclophosphamide. It's actually 3 pages. And again, I include them or include some of them. The list is a lot longer, not to concern you or not to alarm you, but to tell you that when we start you on a medication like cyclophosphamide, it's important for us to know what medications you're on, so that we do what we need to do in terms of managing these drug interactions. Some interactions we cannot avoid. We have to use the combination of medications because you need to be on these 2 medications for a good reason, and so we monitor extra carefully, and we make sure that we're capturing any toxicity early on, and that's a common theme that you're going to see with a lot of interactions. Really, it's just monitoring is key, and monitoring is important to capture anything before things go bad. So there's medications that we use for gout. Allopurinol is used sometimes to prevent gout, and indomethacin is an old non-steroidal anti-inflammatory that's used for gout. Now we use other agents. These tend to interact with cyclophosphamide, but indomethacin, more importantly, should be avoided because it tends to increase the risk of accumulating water in the lungs and causing water intoxication in general. Ciprofloxacin is an antibiotic that we sometimes use for urinary tract infections. Sometimes the cyclophosphamide decrease the effectiveness of ciprofloxacin. So maybe you're not getting the intended effects of ciprofloxacin because you're on cyclophosphamide. So if that happens, the physician might change this antibiotic. Bupropion is a medication that's given to elevate the mood, but it tends to interact with cyclophosphamide. So it increases the concentration of this bupropion. So you might experience some insomnia, extra insomnia, or extra dizziness if you're on the combination, and your doctor might decrease the dose of bupropion if that's the case. Cyclophosphamide also goes through these doors or enzymes that we talked about earlier. So inhibitors or enzymes that close these doors would reduce the activation of cyclophosphamide and reduce its effect. And inducers, those that open these doors wider, will increase the activation of cyclophosphamide and increase its toxicity. So again, really important that we know what medications you're on to try and understand how these interactions will affect you. We'll explain that to you, and we'll have a plan in place to manage them. The second page, again, so more medications. I tried to bunch them up together on one slide. These are all medications that more or less are related to the cardiovascular system, your heart and blood pressure and blood thinners and the like. So again, really important to let us know if you're on any of these medications, and these are fairly common. A lot of patients are actually on them, so we can monitor for their effects. And you can see that in terms of management for these interactions, a lot of it is just monitoring and making sure that we are aware of these interactions, so that when something happens, we know exactly why it's happening and we know what to do. And the last page here are medications that can maybe cause kidney issues. There are some medications, sulfonylureas are medications that are used for diabetes. In the end here, these medications are used for arthritis, rheumatoid arthritis. And again, the importance of letting us know what you're on before you start these medications is really important for us to know what to monitor for, and if we can suggest any alternatives or hold certain medications while you're on the chemotherapy is very important. So that's really the point that I wanted to drive home, is that in order to identify these drug interactions every time, ideally you want to keep an up-to-date list of your medications, and to try and use the same 1 or 2 pharmacies, so that these 2 pharmacies or 1 pharmacy ideally will have the list of all your medications, and every time you're starting something new, they're able to capture all these drug interactions, because you know, that's something that they need to sort out every time you're starting something new. Melphalan is the other chemotherapy agent that we have. It's absorbed well with or without food. Echinacea tends to decrease its effectiveness. No established laboratory tests with melphalan, and it can cause mild dizziness, especially if taken with alcohol. Cimetidine is an old medication that we use to reduce stomach upset and heartburn. So it tends to decrease the availability of melphalan. It tends to decrease its absorption. So we monitor, or we avoid, we switch to something else. Cyclosporin is an immunosuppressant that's used for folks who have a kidney transplant, or a liver transplant, or all sorts of other previous bone marrow transplants. Not a fairly common medication, but if taken together with melphalan, it tends to increase the risk of kidney injury, and so we monitor renal function regularly. And digoxin, finally, is a medication that interacts with melphalan in the sense that melphalan reduces the effect of digoxin, so we can monitor the levels, we can adjust the dose if necessary, and we can switch the formulation if we need to. Steroids are the second last class that I'm going to talk about for multiple myeloma. Ideally, they should be taken with food, and for medications that can be taken on an empty stomach or with food, if they cause stomach upset, you can go ahead and take them with food. But dexamethasone and prednisone are known to cause stomach upset and ulcers, so we usually recommend taking them with food every time. St. John's wort and echinacea, again, common herbal products that interact with medications, and dexamethasone and prednisone are no different. Again, I mentioned this idea earlier with cyclophosphamide, is that they may suppress allergy skin tests because they are suppressing the immune system as a side effect sometimes. And then there's no established lifestyle factor interactions with dexamethasone and prednisone that we know of. So the list of interactions with these steroids is also long. So again, medications with diabetes, medications that affect the liver enzymes that we have here, medications that affect high blood pressure, iron chelators, mood agents. But the idea is to recognize these medications, to let the doctor and the pharmacist know if you're on them, and then they will tell you what to monitor for, whether to monitor your blood sugar, whether to monitor your blood pressure, whether to monitor your mood, and have a plan in place ahead of time for when the interaction becomes significant. The list continues with more agents. So again, the idea here is not to get bogged down by the number of items on the list, but to understand the importance of knowing what medications you're on when you start these medications. The final class that I'm going to talk about here is the monoclonal antibodies. This is the newest class of medications used in the treatment of multiple myeloma. These are generally very clean in the sense that they don't have a lot of drug interactions, and because they tend to target the myeloma cells specifically. These are injectables, so it doesn't really matter whether you take them with or without food. They don't go through your stomach, and there's no specific food item that interacts with them. Echinacea tends to decrease their effect because it affects the immune system, and because they are antibodies themselves, they tend to affect immunoassays. Some of the immunoassays are actually used to monitor the control of multiple myeloma itself, but the physician knows that once you're in daratumumab, they know what orders, what tests to order and how to interpret these tests. There's no established drug interactions with lifestyle factors in multiple myeloma. I highlight this again because this is something that the physician might go over with you once you're on daratumumab of how to interpret some lab results that you're interested in following and knowing about. Daratumumab can cause high blood pressure. I've seen a few of these reactions myself, actually. So if you have hypertension or high blood pressure, usually on the days that you get daratumumab, in about 1 in 10 people, there is an increase in blood pressure. So we monitor that when you come to the infusion clinic, and we give you more of or higher doses of the blood pressure medications, and we sometimes add blood pressure medications for that day just to control the blood pressure. This, again, does not happen with everyone, but sometimes those who have a history of hypertension, it can happen with them more. Ixazomib is newer than daratumumab, not commonly used yet. Again, very similar, injectable, no interactions with food. Echinacea can interfere with its activity. It tends to affect immunoassays as well, and no lifestyle factor interactions. Tends to interact with medications for blood pressure, because in some patients it can increase blood pressure, so we monitor for that whenever you get it. It sometimes tends to increase blood sugar as well for some patients who are on diabetes medications, so we monitor that as well, and we adjust or add medications to control that. And then finally, it tends to also cause some peripheral neuropathy, so tingling, burning sensation, things like that, similar to what we talked about earlier with Proteasome. And if you get that while you're on the elotuzumab and you have some of these medications, then the doctor might change your medications or reduce their doses. Finally, in this section, general interactions that are true really for all therapies for multiple myeloma, which is there are some medications out there that can suppress the immune system or slow down recovery of the immune system after you get these medications. So let your doctor know, and you might not know all of them. I certainly don't know all of them, but if you let your doctor know what you're on, we can check for them, and we can make sure that we're aware of that, and any effects that we might see, we can at least are able to explain and do something about. There are medications that affect that cause myelosuppression. So these can cause added fatigue or increased risk of bleeding because they affect the hemoglobin and the platelets, like carbamazepine, for example. And again, knowing about them, we would know what effects to look out for and what to do. Medications and herbals that affects the body's ability to form blood clots, a lot of herbal products like turmeric and ginseng. It's important to let your pharmacist or physician know if you're taking them, because you might have to hold them while you're on these chemotherapeutic agents. Medications that can alter the immune system, echinacea, you've probably seen it multiple times during this presentation. Ginseng, for example, because a lot of these chemotherapeutic agents utilize the immune system to fight these blood cancers. It's important to not interfere with that, at least when you're taking them to treat. After that, you can have a conversation with your physician or pharmacist about when it's safe to restart these herbals again. Vaccines is another important one. Live vaccines, when your immune system is compromised, it's usually not a good idea because it can cause infections. And inactivated vaccines, when your immune system is low as well, will likely not give you the intended full immunity, because you need the immune system to recognize the inactivated vaccine and build that immunity. So your doctor will tell you when to get vaccinated, whether it's live or inactivated vaccine. So the last part here is I just want to summarize the key points that I talked about today and what you can do to help identify these drug interactions and monitor for them. A lot of these things I already mentioned throughout the presentation. So keep an up-to-date list of your home medications. You can print it out from your home pharmacy. Every time there are changes, print a fresh new sheet. If you take supplements and natural health products, include them on your list. It's very helpful to include the ingredients of these products as well. So I usually tell my patients to take a picture of the back of these products. That way I can look at all the ingredients and see if there's any interactions. If possible, try to fill your medications in 1 or 2 pharmacies. That way the pharmacists that are at these pharmacies have a full picture of what you're on. Every time you get a new medication or buy an over-the-counter product, check with your pharmacist to see if there's any drug interactions with these existing medications. And then lifestyle factors like drinking and alcohol, like we saw, or smoking can interact with myeloma medications. And so your pharmacist might ask you about these, and you can certainly ask your pharmacist about how to manage these interactions. And the last page here is chronic medications like high blood pressure and diabetes, like we saw, might require closer monitoring when you start multiple myeloma medications, because they might interact with that. So let your doctor know if you're noticing any changes in the readings of your blood sugar and blood pressure. Oral medications might interact with food, so you want to know if you should take them on an empty stomach, with or without food, they might interact with specific food items, so your pharmacist will tell you about that. So it says here, this is the last point, because some food items can interact with the medications, the pharmacist might ask you to avoid them while you're on certain medications. Ask your pharmacist for detail. They're happy to help you. Thank you so much. Sorry I talked for too long, and I'm happy to answer any questions you have.
Thanks, Al-harith. That was a lot of information, and
Yes.
I'm sure there's so much more information that you could probably go on for another hour or even 2 more hours.
Yes.
So we do have some questions here. So the first one is simply, and a lot of questions will be like this: is what about this drug? What about this? Does this cause any problem? Can this cause any issues? And so this question is with regards to something like Metamucil and Daratumumab, Revlimid, and Dexamethasone regimen. If there's any concerns over there with regards to Metamucil.
Yeah, Metamucil certainly interacts with a lot of medications, because it's a fiber laxative, a bulk forming laxative. So when you take it too close to the dexamethasone and to the Revlimid, then it tends to reduce the absorption. So if you look at Metamucil, they recommend that you separate it by 4 to 6 hours before or after these medications. I don't think it interacts with the Daratumumab, again, because it's injectable. It doesn't go through the same pathway that the Metamucil goes through. But certainly things that have high fiber content tend to hold medications and reduce their absorption or alter their absorption. So okay to take, but not very close to these medications.
Okay, thank you. And when you say injectable, I mean, are you kind of lumping in infusions with injections?
Yes.
Or
Yes,
okay.
I am. Yeah.
Okay, so either infusion or injection, kind of the same pathway.
Yes.
The next question: how about artificial sweeteners have had kind of a bad rap since they've been introduced, and so soft drinks or artificial sweeteners, are there any concerns with taking those with any regimens?
Yeah, I mean, there's a lot of chemicals out there, right? That we don't necessarily know, the significance of their interaction with these medications. So if possible, if in doubt, and things can be avoided, I usually recommend avoiding them. Nothing really comes to mind when it comes to specific items there. But again, just looking at ingredients and maybe asking the pharmacist, they can run through these ingredients with the regimen that you're on through an interaction checker, and then they can identify whether maybe a different type of sweetener is warranted or better for you. But nothing comes to my mind, to be honest.
Okay, yeah, thank you. We saw echinacea come up a lot, and so the question is, just like you said with something like daratumumab, because it's injectable or infusion, you're not really having many food interactions. But something like echinacea, if you take it in tablet form versus taking it as an essential oil, or maybe rubbing it on your skin.
So things that we rub on our skin, there is usually minimal systemic absorption. So that certainly tends to decrease the chances of them interacting with injectable medications or oral medications, because the amount of drug, topical drug that gets absorbed into our system is low. But echinacea can affect the immune system. And if you look at all these monographs for all these medications that target the immune system, there is certainly an interaction, and but the extent of this interaction is certainly a lot lower if the echinacea is used topically, not ingested.
Okay, thank you. And I saw on one of yours on the cyclophosphamide slide, you had one of the first one on the list you had was allopurinol, and automatically it
Yes.
made me think of shampoo.
Yes.
and,
Yes.
uh,
Yes. Yes.
and
No.
and so like no concerns with shampoo or any
Yes.
absorption through the scalp or anything like that?
No, I don't think so. I mean, the other thing is sometimes we use allopurinol with these medications because we have to, because sometimes the uric acid levels are too high. It's not very common with multiple myeloma because it's more common with other types of cancers like lymphoma and leukemia. And there we use the allopurinol not as a medication to prevent gout, but to reduce the amount of uric acid that's a byproduct of all the cancer cells that are dying, and we use it with cyclophosphamide. So it can be used, but if we don't have to use it, we would like to avoid it. And I'm talking about oral cyclophosphamide. I'm talking about oral allopurinol that's taken with cyclophosphamide. So let alone things that are topical, then again the absorption with that is very minimal. So the concern is not there for sure.
Thank you. And the last question, I guess it's a two-part question. It has to do with complementary therapies, as we say. So therapies that you kind of use together, or to alleviate some side effects
Yes.
from your other medications. And so, as you know, cannabis has been approved.
Yes.
It's been a while now, a bit over a year that it's been legal. Recreational cannabis has been legal. Any interactions or concerns with cannabis?
Yeah, our main concern really with cannabis is especially inhaled cannabis or smoked cannabis. There is a lot of case reports out there that there are fungal spores that might be in these products that when are inhaled and you have a working competent immune system, that's not a concern because any of these fungal spores are handled well by the immune system and there's no concern. But if your immune system is compromised, either because we haven't controlled the disease yet, we're in the process of controlling the disease, or because some of these medications that we give can cause your neutrophils and your immune system to be a little weak. That's why we don't give them sometimes continuously. We give some breaks for the immune system to recover. If these kinds of situations are there where your immune system is not working at an optimal level and you get exposed to these fungal spores, then there is a high chance of getting what they call an invasive fungal infection. So that's fungus growing usually in the lungs, right? So that can be more difficult to treat, and the medications that we use for that are medications that you're going to have to be on for weeks, if not longer, and they have their own interactions as well. So because we know that can sometimes happen, there are evidence of that in the literature. We typically recommend against using inhaled or smoked cannabis for sure. And also a lot of the cannabis products are not necessarily made in a pharmaceutical or made to a pharmaceutical grade product in terms of sterility and how clean or sterile the product is. So we just worry about that, just like we worry with with any other pathogen getting into our system when we have compromised immune system.
Yeah, that totally makes sense.
Mhm.
And lastly, sticking with the complementary therapies, there's there's a whole slew of them, like mistletoe, and I'm not going to ask you to go through all those lists, but is there maybe one specific complementary therapy that like I know you've mentioned vitamin C, for example, but is there anything else when it comes to maybe a less conventional type of agents,
Yeah, yeah.
or
Well,
even like something like acupuncture? Can that,
yes.
I know that you get needles put into your skin. Can that cause some kind of interaction?
Yeah, so acupuncture, maybe I'll talk first about acupuncture. It sometimes when our platelet count is low, we run the risk of having bleeding, and usually the platelet count can be low because of the disease itself. If you remember earlier, we mentioned that myeloma is a disease of the bone marrow, and the platelets are made in the bone marrow. So when the disease is very active, the platelets will be low for sure. And sometimes the platelets are low because of the therapy that we're giving, because some of the side effects of these myeloma therapies is that they would suppress the bone marrow as they're killing the myeloma cells. So for a period of time, a myeloma patient will have low platelets, and they have to be extra careful about not doing activities that might increase the risk of bleeding, including acupuncture or getting injections that might cause some bleeding, and then you don't have enough platelets to plug that bleed and stop it. That's really the main concern. Once you're outside of that window and wanting to try acupuncture or resume acupuncture, certainly talk to your doctor, and if they can see a trend of your counts being stable and they're comfortable with that, I think they will likely tell you that it's okay to resume. But when things are not steady yet and they're not stable yet, we tend to say maybe hold off on that now. The other thing to go back to other complementary therapies, we see that frequently actually with our patients, and our approach to that is, while you are getting the chemotherapy and the myeloma treatment regimens that we're giving you, we ask that you hold off on the complementary therapies as much as possible, simply because we don't know if we combine the two together what the outcome is. Sometimes we think that the outcome will result in more toxicity, and sometimes we think the outcome will result in less effectiveness, like we saw with the vitamin C. But we usually recommend to our patients to holding off on these complementary therapies, get the chemotherapy, and then once that's done, talk to your doctor about restarting these. But combining things that we think might interact or know might interact, and sometimes we don't know if they even interact, because we don't have situations where patients have been on the two together, or it's not studied when these drugs were approved and came to market, they were not used with these medications. We haven't had enough cases or history to reflect on to even know if there is interactions or not. So in order to minimize these interactions, we typically ask our patients to hold off if possible while we try to do this thing. And once that's done, if you certainly want to go and explore other things, by all means, just let the doctor know. That way we know that the chances of having these extra drug interactions that are known and unknown is not necessarily there anymore. That's really our approach.
Yeah, and for sure, it's better to be safe than sorry. You
Yes.
don't want to
Yep.
cause more problems than you have to,
Mm-hmm.
if you can just hold off for an extra day or two or whatever the case may be.
Mm-hmm.
So with that, that ends our webinar. Thanks again for taking the time to do this. I see we have a lot of references and resources here. The product
Yes.
monographs for a lot of the drugs. Basically the instruction manual that comes with all the drugs and
Yeah.
nice links to that. So I remind everyone that this presentation was recorded, and so it's going to go up on YouTube in a few hours. It'll be there, and so there was a lot of information. So you can just go back to a slide that maybe had a lot of information and kind of just study it a little bit and read up a little bit on the drugs that were listed there as interactions. And so thanks again for taking the time this afternoon, Al-Harith. I wish you an excellent evening and have a nice
Thank
weekend.
you. Yeah, you too. Thank
Yeah,
you so much. Thanks, everyone.
thanks. Bye-bye.